Always focuses on the needs, concerns, and achievements of the differently abled. I'm your host, Lauren Seiler. On this edition, we will focus on SUS, Services for the Underserved. Joining me today to discuss programs in mental health is Luis O. Lopez. Thank you, sir, for joining me on this edition.
It's my pleasure.
Thank you so
for
much.
having us.
Thank you. Tell me the missions and goals of SUS.
Well, SUS has been around since 1978. We presently work with 5 departments. We have services for individuals that have developmental disabilities. We have services for individuals that are experiencing psychiatric disabilities. We have programs servicing individuals that are living with AIDS. We have programs that serve people that might need nursing care or an aid, and that's our home care department. And we also have a school at Wainscott, Long Island, that provides services for individuals that have developmental or learning disabilities.
Okay. Since you're here to discuss people with mental challenges or psychiatric disabilities, describe the many programs that SUS has with for people who have psychiatric disabilities or special needs.
Well, we currently serve over 1,000 individuals in our mental health department. The senior vice president of that department is Dr. Eve Addis, and the director of that department is Wanda Lopez. They pretty much supervise over 850 residential units, and also have about 3 outpatient programs. A program that provides services for employment, a program that has an acting, which we could talk a little bit about. It's one of the evidence-based practices. And also we have a wonderful clubhouse in Brooklyn.
Okay. Now, when you talk about psychiatric special needs or disabilities, people get often scared. Can you get rid of the stigma now on this show and explain why people shouldn't be scared when it comes to people with psychiatric problems?
You know, you're asking the question of all ages, honestly. I think the biggest obstacle, besides just the struggles that individuals with psychiatric disabilities have, is the stigma. And the stigma has this duality. One is the stigma that comes from the outside. This is the stigma that people give you based on not understanding where you're coming from. But this stigma is so powerful that eventually the individual, him or herself, begin to believe in it. So they believe in the stigma, and it becomes a huge barrier, a huge obstacle.
So if people say to them, oh, you're mentally challenged, you know, you have this diagnosis or this diagnosis, and then it brings them down somewhat.
Absolutely.
Instead of talking to them positively.
Absolutely. Yes.
Describe some of the many programs that you guys have, step by step, for people with mental challenges.
Well, our focus mainly relies on housing. We are a wonderful agency providing great housing services. Many of our housing programs are in Brooklyn, in Queens, and also in the Bronx. We recently had a community day over here in Morris Heights, and we're opening a new residential housing program that's going to be having 48 units. And we're very excited about this program that's opening up in Morris Heights.
Why are you guys excited about the new program? Because I know that there are different types of residential facilities. There's group homes, and then there's residences, SROs, TSOs, and the whole gamut. Explain why you're excited, but then can you also explain the different types of housing for people with mental challenges?
Absolutely. Thank you for that question. The housing that we're right now opening at Morris Heights is supportive housing facility. And what happens is that these are individuals that need some engagement, some supervision, but really they are individuals that have lived in the community, are doing very well. Some of them are working, some of them are going to school, and they just need some support to continue their recovery. Like I mentioned before, this is going to be a house that has 48 apartments. Each apartment is going to have a kitchenette, their own bathroom. It's going to be living room area, recreational area, and it's going to have 24-hour staffing.
Okay. Now, in terms of the programs, you have also recreational. You have day hab. You have a bunch of other programs. Besides the living situations, what are some of the programs that people are hooked up with SUS in terms of mental health?
Well, housing is really our biggest area. Some of the other services we provide are, for instance, we have an ACT team. And in ACT team, the ACT word is an acronym for Assertive Community Treatment Team.
Okay.
This is one of the new evidence-based practices that the Office of Mental Health has committed into bringing into New York State. ACT teams have been around for almost 30 years, and they started in Madison, Wisconsin. And the ACT team model is very unique because it tells you this. This is the theory where they're based on. Individuals, when they come into the emergency room and they go into the hospital, begin to feel better, and they do well.
Yeah.
The problem is that when they leave, all those supports end
Okay, so they don't get any more support.
in the community, and eventually individuals come back.
Okay.
Okay, this is the history and the tragic history of mental health. So it's a cycle, though. People come in, they come out. They come in, they come out. ACT teams challenge that. And the challenge is this. What happens if we provide the support that people get in the hospital outside in the community?
Okay.
So ACT teams are composed of a doctor, 2 nurses, a vocational specialist, a substance abuse counselor, and 2 peer specialists that go and come to the person's house to provide support, counseling, and engagement.
Okay. Since you said support, counseling, and engagement, where do you guys come in with that in terms of the support is the housing? Okay. They have housing. They have food. Do you guys make sure that they're clothed correctly, or how do you guys work with that in terms of the supports within the housing? How do you guys?
Well, many of the individuals in supportive housing receive benefits.
Okay.
So they take care of their own clothing. They might take care of their food. If they need support in any area, we come in and we have discussions and develop plans to help individuals. But pretty much a lot of the individuals in supportive housing are very independent financially. Yeah.
Now, do some of them work?
Yes. Yeah, many of them are working. SUS, by the way, is one of the agencies that provides employment for individuals that live in our houses.
Now, how does that work in terms of getting the supports that people need?
Yeah. Well, there's different tracks that people could follow. One of them is to join our employment services program, which runs in Brooklyn. And this particular program provides counseling, helps people with their resume. It introduces people to job opportunities, and when people get their jobs, they provide coaching, which is wonderful. Another way will be for a person just to apply based on what positions they have open in the particular sites that we have throughout Brooklyn, Queens, Manhattan, and the Bronx.